Hello, my name is Wes Hayden, President and co-founder of CoachCare. In this video, we will dive deep to explain how health systems and physician groups add over $1 million of monthly revenue and improve patient outcomes fast without adding staff or chasing new patients. And that revenue increase, it could be even higher for you depending on your patient volume. So here are examples of healthcare organizations having success. Here you can see that our client, CoreLife, a fast-growing national physician group, grew their remote patient monitoring program from zero to nearly $100,000 in monthly revenue with approximately 500 patients. And as you can see, at this rate, it only takes about 5,000 patients to reach $1 million in monthly revenue. Also, here you can see how our client, the Hernreid Center, a large physician center of excellence, grew its remote patient monitoring program from zero to $21,000 in monthly revenue with approximately 100 patients. And here, you can see how our client WestMed, a multi-specialty physician group, grew its remote patient monitoring program from zero to nearly $42,000 in monthly revenue with over 200 patients, and they're continuing to grow every month. And again, here you can see how our client TPMG, a multi-specialty physician group, grew its remote patient monitoring program from zero to over $55,000 in monthly revenue with nearly 300 patients. Now, we have clients all over the country, so you can see this really works anywhere and with any number of specialties. And here is a great case study of improved outcomes for real patients on our platform with one of the most common chronic conditions, obesity. Now, this is a cohort of over 1,000 of our clients' patients with weight management and obesity diagnoses. Now, out of this cohort, patients using RPM services lost 86.3% more weight than patients that were not using RPM services. And also, RPM patients stayed on their programs 30.2% longer than non-RPM patients. And none of these clients in this study here had to add staff to deliver these improved outcomes and engagement results. And look, along with these proven results that I just showed you, there are significant market tailwinds. So CMS and commercial payers have consistently expanded support for RPM services the past several years in line with the broader transition to value-based care. And they've kept those reimbursement rates strong and increased flexibility for providers to utilize RPM by allowing them to utilize auxiliary staff and to support additional diagnoses. So this makes RPM even easier to implement and to generate robust reimbursement. And of course, this also works in the value-based or risk-based setting because the outcomes results that we're driving with RPM through the preventative outreach and intervention also drives the bottom line in those business models as well. And you can learn more about this by looking at the websites for CMS or your commercial payers. So who is this for? Well, this is for you if you're a health system or physician group leader that needs to add substantial revenue to your organization and you're trying to build a best-in-class patient care program you can be proud of. Really, this is the case where this information is for you. And if you've tried to launch new services and gotten frustrated by all the bureaucracy, well, you're not the only one. This is for you. If you look ahead and are concerned about the financial prospects for your organization, then this is for you. If you feel like you and your team work hard every day, but you just can't seem to help patients enough, well, this is for you. And if you think your patients deserve better care than just an annual visit, this is for you. And lastly, if you're concerned with the continuing reductions in insurance payouts for your life-saving services and you're frustrated by ancillary services and products that don't pay off, again, this is for you. This is not for you if you don't accept insurance in the US, don't have a few hours to invest up front, or are not comfortable with new technologies. So the core concept is there are game-changing ways to double your revenue or more without adding even a single new patient. So you probably know physicians and their staff, they're constrained by time and resources, so they have to use those well. But you're really challenged to move the needle in terms of revenue growth because the traditional approach of adding new patients isn't scalable. So we all know you can add revenue to your organization by attracting new patients. However, adding patients is expensive and it puts pressure on already overwhelmed staff. So it's also not scalable because the maximum number of patients you can see is limited by the number of hours you work in the day. And you have to add a lot of new patients to have any meaningful impact on your revenue. So just think about this. Is it even possible to double the number of patients you currently see? So since 2013, all we have done is help physicians generate more revenue with existing patients and existing staff fast. So here's a bit of background on Coach Care. So for those who don't know me, my name is Wes Hayden. My co-founders and I started our company in 2013, following careers as private equity investors at multi-billion-dollar funds in New York. And that's where we saw the challenges faced by healthcare providers working to grow revenue and improve patient care in the face of increasing costs and declining reimbursements. So we actually started our business as a virtual care solution for patients with chronic conditions and originally built our technology platform to serve the needs of our own clinical staff. See, we knew this type of proactive monitoring was beneficial to patients, even though these services were not reimbursed at that time. But eventually, we recognized that our core competency was providing the technology to support other providers and their patients. So we transitioned to focus solely on the technology. And since then, we have refined and proven our technology with thousands of health systems and physician groups and other practices and hundreds of thousands of providers and patients throughout the US and internationally. We've also raised venture capital funding from top healthcare-focused funds, including Clee Capital and Stonehenge Growth Equity, and they saw the innovation we were bringing, to the healthcare world. So as a result, today we are driving consistently strong claim success rates, revenue, and ROI for our clients. And we are also a profitable and stable business with proven success in this market for many years now. And look, I think we're proud of the awards that we've won, the clients that we've brought on, thousands of organizations and partners as well. You can see some examples of those, here. Some health systems and large physician groups you might know, and some of our partner organizations. But now let's walk through the activities you need to do to achieve the significant increase in revenue and improvement in patient care that I noted earlier. So first, get paid more for each patient while improving their care through remote patient monitoring, or RPM. So, again, the old way to increase revenue is by trying to bring in new patients with marketing, directory listings, or referrals from other physicians. But again, marketing to new patients is expensive and it's time consuming. And even in the best case, it can't add much more than 10% to your top line due to staff capacity. So you spend a lot of money and time to get very few new patients. And unless you have a world-class in-house marketing team and 3 top-tier agencies, most marketing spend, unfortunately, is going to be wasted. So after spending tens of thousands of dollars, you may add a few patients and then realize you can't scale further due to staff capacity. But there's a better way. The better way is to prescribe reimbursable RPM treatments for your existing and new chronic, at-risk, and post-acute patients, which is likely the majority of your patients. Generate substantial new revenue from your existing patient population while avoiding the wasted spend inherent in marketing. Drastically improve the efficacy of your treatments and watch as your patients get and stay excited about their care. Also, get your staff focused on value-added activities and reinvigorated by doing good while also doing well. And you'll find you will fill underutilized or under-reimbursed junior staff time with this periodic monitoring of your patient's progress. So the core insight of this activity is that pushing your organization to patient capacity, it actually may constrain your business, not accelerate it. See, for each new patient you bring on, you incur direct and indirect costs. And as your staff feel more and more overwhelmed, the quality of care must decline for every patient as time per patient declines, and so also staff morale crumbles. But see, earning more revenue per patient, it has the opposite effect. See, you can make more money without chasing new patients, which allows you to provide better care and maintain satisfied, high-functioning staff. So just take a look here. Hopefully you can see that out of this, even with fewer patients, an organization can dramatically increase revenues through RPM. And the bottom line is you can generate potentially double the revenue with half the number of patients. And then just imagine how much less stressed your team will be. So let's go over a few questions that commonly come up with this activity. So first of all, why shouldn't I overwhelm my organization with every patient I can find? Well, doing so, it just impairs the quality of care because you're forced to spend less time with each patient to then move on to the next. In addition, this leads to long, stressful days and overworked, dissatisfied staff. Next, can I take advantage of these services with my current staff? Yes, absolutely. Your current staff can use underutilized time to deliver these services. In addition, since you are not overwhelming your organization, your existing staff will have the capacity to focus on patient care, including RPM. But perhaps most importantly, you'll be reimbursed for simply capturing data on your patients, which requires no staff time at all. New services are hard to implement, so how is this different? Fair point. But see, the thing is, RPM is not actually an entirely novel medical procedure or a new drug, and it does not require any new medical equipment or space within your facilities. In fact, you and your staff are likely providing some of these services already, just without getting paid. See, monitoring a patient while they follow your treatment plan to ensure they're improving, it's actually common sense, both for patients and providers. So RPM is really easy to explain and to understand. And in addition, much of the effort is handled automatically by our software. And at the end of the day, implementation just requires training your billing and clinical staff for up maybe 2 to 4 hours of total time. So you can expect to be submitting your first claims within 3 or 4 weeks. Now let's talk about our next key activity. You need to monitor patients and proactively target those that need care most. So let's look at an example of the old way of treating patients. And this is actually the exact experience of one of our clients, Dr. Musco of Diablo Family Physicians, part of a larger physician group, before he worked with Coach Care. So first of all, after an appointment, you wish your patient well, and they schedule a follow-up weeks or perhaps even months into the future. And then fast forward to when they come back, well, you rush to review their chart before sitting down with them for perhaps 5 minutes and maybe making a minor adjustment to medication, and then rinse and repeat. So you interact with patients infrequently, and so you only learn about new or worsening medical issues when patients come back into your facility weeks or months later, or in some cases, unfortunately, when they're taken to the emergency room. But again, there is a better way. The better way is for patients to transmit key vitals to you in real time from home. You are reimbursed for having junior staff periodically review the data, and you are alerted if data falls outside of predefined healthy ranges. In addition to billing for this data collection, your staff is able to quickly identify and respond to patient needs and prevent urgent medical situations. So this allows you to proactively engage with patients that need your help right away, not months from now. So the core insight of this activity is that the greatest impact you can make on patient care is actually in between visits. You need to know when patients need help and what they need as efficiently as possible. Because 99.9% of the time, patients are not in your office. For example, getting a blood pressure measurement once per year isn't enough, and it can lead to a misdiagnosis. Getting the right data at the right time allows you to better care for patients. And payers have finally woken up to this, and they'll reimburse you well for monitoring patients this way. So following on from my example around blood pressure, this is the situation of a real patient with hypertension. And this outcome really is common across other patient conditions that we monitor. So for this patient, blood pressure readings at the doctor's office were in the healthy range, but as you can see, the readings at home were elevated, sometimes to dangerous levels. See, this patient would have been misdiagnosed for almost a year. But monitoring patients from home like this allows physicians to respond early to changes in patient health while getting paid for the service. And this is the third and last key activity. make sure you get paid. See, the old way to get insurance reimbursement for new services like RPM was to rely on your staff to figure out how to deliver and bill these new services on their own. And as a result, you get paid less than you should because of denied claims, and you wait forever for payments because of delayed claims. And this is understandable. This is because your staff is not familiar with this new service and has to get up the learning curve to bill it efficiently and successfully. So the better way is to rely on an expert to train and shepherd your staff from delivery to cash collection, or even to do the billing for you. You get up the learning curve quickly, you get paid without the frustration of denied and delayed claims. So the core insight of this activity is that getting reimbursed for RPM is easy when you know what to do. RPM is a new service and it has specific requirements, but an RPM expert can easily explain the right steps to deliver and bill it, or can even do the billing for you. And so here's an example of the type of expert approach you want to assist your billing staff. See, billing insurance, it isn't difficult, but it is process and detail oriented. And if you look on the right-hand side here, if you're using already proven best practices in documentation and relying on experts, that will ensure you are paid the full amount you deserve. So here's the game-changing method to increase revenue and improve patient outcomes. In summary, all you need to do is this. 1, implement remote patient monitoring services. 2, monitor your patients. 3, rely on experts to make sure you get paid. And then collect over $1 million per month and improve patient outcomes in just a few months without adding staff or new patients. It's that simple. Now, there are 2 ways to increase your revenue using RPM. The hard way is you implement RPM with another company, which could cost you hundreds of thousands of dollars per month in lost profit compared to working with us. Now, this is due to lost RPM revenue, higher subscription fees, and additional custom work costs. Or there's a better way. Work with CoachCare and launch your fully customized remote monitoring solution within a couple months, submit your first claims immediately, and generate hundreds of thousands of dollars per month in additional profit. So to reiterate, this is for health systems and physician groups who need to add substantial revenue and improve patient care in their organizations without adding staff or chasing new patients. And again, here are some examples of the over 3,000 healthcare organizations that have used us to dramatically increase revenue and improve patient outcomes in 3 months without adding staff or new patients. So this is our client CoreLife, fast-growing national physician group, grew their remote patient monitoring program to nearly $100,000 a month with about 500 patients. Now, CoreLife has dozens of locations throughout the East Coast and serves hundreds of thousands of patients. So their program is just continuing to grow. And here's actually a quote from the RPM lead at CoreLife, just highlighting the success of our partnership. And also, here's the Hearn Reed Center, a large physician center of excellence. They've grown their program to over $20,000 a month in revenue with about 100 patients. And Hearn Reed drives referrals from numerous specialties and supports thousands of patients across Northern California. And here you can see WestMed, multi-specialty physician group, grew their RPM program to nearly $42,000 a month in revenue with about 200 patients, and again, just continuing to grow today. And WestMed is based in the New York metro area and supports tens of thousands of patients there. So lots of opportunity for growth. And here is TPMG, a multi-specialty physician group that has grown to over $55,000 in monthly revenue from RPM with nearly 300 patients. And TPMG is based in Virginia and supports tens of thousands of patients there. So again, we have clients all over the country, as you can see, and this really works anywhere and also with many different specialties. And here are a few examples of testimonials from other clients of all sizes. Again, health systems, hospitals, physician groups, independent practices. And you can really take some of these revenue numbers we've shared and extrapolate them for your patient population. Again, we've seen it work at all sizes. So this organization here on the left is in Washington State, The organization on the right is based in Pennsylvania. Here are a couple more testimonials, again, from clients of different sizes. The organization on the left is in Arizona, and the organization on the right is in Wisconsin. And along with this proof from our clients, I would like to reemphasize the broader regulatory and market support for RPM. So as we mentioned, CMS and commercial payers have consistently expanded support for RPM services the past several years in line with the broader transition to value-based care. So they've kept reimbursement rates strong, but also increased flexibility for providers to utilize RPM. And they've done this by allowing them to utilize auxiliary staff and to support additional diagnoses. So this makes RPM even easier to implement and generate robust reimbursement. And you can learn more about this by looking at the websites for CMS or your commercial payers. And again, as I mentioned before, this really operates well also in risk-based models. But you can also look at numerous credible industry publications highlighting the growth in RPM. See, the usage and utilization of RPM, it is expanding rapidly. In fact, it is estimated that nearly 88% of healthcare organizations are currently using or intend to consider RPM technologies. So we're still early in the growth of RPM tools, but the momentum is really picking up. So the time is now. So here's what's going to happen when you work with us. You can expect to add $1 million or more of monthly revenue in 3 months. This will be high margin revenue due to the low or no costs to implement and deliver RPM. You will be able to achieve the better patient outcomes that you've been seeking your entire career. You can finally get rid of wasted marketing spend and processes designed to push patients through as fast as possible at the expense of quality care. And you can forget about overwhelmed staff and morale issues. In fact, you'll actually feel fulfilled because you'll be doing good for your patients while doing well for your business. And lastly, you will finally be able to stop thinking about financial pressure on your organization because you will have the solution. The solution's RPM. So how does the platform work? Well, before, when you wanted to add revenue to your organization, right, you would have to spend a significant amount of time and money up front to market to new patients. And you didn't always have that work out, didn't always result in more revenue. But now, you can use CoachCare's award-winning RPM platform, including a custom-branded patient mobile app and provider web dashboard, paired with our proprietary connected scale, blood pressure cuff, glucometer, and pulse oximeter, which work together to meet the requirements for RPM billing. So this enables you to generate significant revenue without the big upfront investment in time and money. Also, before, you never had the data to identify and to intervene with patients between consultations, when vitals or other biometrics might dictate that they need help. You've had to wait until they come into the office for their next appointment, which may be months later. And this frequently leads to a condition progressively worsening, and unfortunately, in the worst cases, emergency room visits. But now, you can use our real-time health tracking and automated alerts to remotely monitor and proactively target patients for intervention without needing to add staff. See, these features, they make you immediately aware of problems, and using our additional telehealth suite of tools, they allow you to address them before they become worse. And again, before, if you wanted to get paid for RPM on your own, you would have to rely solely on your own staff to figure out how to deliver and build these new services. And they may not have experience with these new services. So that could result in a slower ramp, lower reimbursements, and frustration for all. But now, you can use our automated time tracking, auto-generated super bills, and on-call AHIMA and AAPC certified RPM billing experts to quickly train your staff, significantly increase the amount of money you collect, and minimize audit risk. So our auto-generated super bills ensure both that your clinical staff is delivering all of the services required to submit claims, so you don't have to miss out on revenue, but they also make the claim submission process incredibly fast and completely accurate. And as I mentioned before, we can even do the billing for you if you prefer. For example, here is a profile of one of our billing experts, Sherry. See, our RPM billing experts, they specialize in delivering and billing these specific services, and they also have the experience and perspective of advocating for our clients across hundreds of payers, which further increases our success rate. Our RPM billing experts, they work directly with CMS and payers and have even convinced payers to start covering RPM for the first time. See, these features and services, they combine together to make sure you collect what you are owed. And here's another testimonial to highlight the positive impact our billing experts have for our clients. And this client is based in Maryland. So again, this works all over the country. So what does it cost? Now, if you wanted to implement a customized RPM program like this with another company, it would cost you $676,000 a month in lost profit compared to working with us. And this is due to lost RPM revenue, higher subscription fees, and additional custom work costs. So here's what you get with us, and I'll take you top to bottom through this analysis. So first, you get complete RPM tracking and reporting tools to avoid manual administrative work and enable your staff to take on higher RPM patient enrollment. So as you can see in this first line, we're able to drive higher patient enrollment as a result. Second, our team of on-demand RPM billing experts assist you every step of the way, which greatly increases your claim success rate from an average of about 50% for new services to 95% with us. And that ensures you get paid what you deserve. And you can see that difference in claim success rate in the second line here, and how that really drives a big difference in the amount of revenue you can generate. Third, you get the custom app for patients to input data without the cost of custom work. And you can see that layered down at the bottom under the custom work line. But the configurability we give you there is a lot more customized than you would get out of the box from most products. And similarly, the custom web dashboard for providers, it allows you to monitor that data, again, without the cost of custom work behind it. And fifth, we have our proprietary connected scale, blood pressure cuff, glucometer, and pulse oximeter to provide valuable objective data from patients' homes at a lower cost than the retail devices used by other companies. So if you look at the device line item under the costs, you can see why that's less expensive with us. And then you also have our custom automated alerting tools. So you are alerted to patients at risk and can proactively intervene, again, without the cost of custom work. And lastly, we have a full suite of telehealth tools for patients and providers to communicate without you having to pay an incremental subscription fee. So together, this makes us significantly more profitable for you than other companies. And as a result of all this, you will add over $1 million of monthly revenue and improve patient outcomes in 3 months without adding staff or chasing new patients. So the investment in our offering to generate all that revenue and profit is only a base license fee of $30,000 per year, plus $30 per RPM patient per month. In addition, it is $60 one time for each RPM patient's device. So to get started, all you need to do is take our short quiz to see if your organization is a fit for RPM. And there's a link to the quiz alongside this video. I also want to make you aware of 2 other considerations. So first, let's discuss timing. So as you probably know by now, we take a hands-on approach with all our clients. We know how to successfully onboard patients and maximize your claims reimbursements. And we'll even train your staff as much as needed and literally submit and reconcile claims with your biller if we're not doing the billing for you ourselves. So this commitment requires significant time from our team. And therefore, we only accept the most qualified and committed new clients. In fact, we'll ask you to sign a statement of commitment during implementation. But because of this time we invest, we only engage in 5 implementations per month. And it's important to make a decision quickly so we're able to work with you. Because remember, you're losing money every day that you delay. You should also know our RPM fees are contingent on your success and backed up with a guarantee. If you don't receive any RPM reimbursement, you get your RPM fees back. We only get paid if you get paid. So to summarize this offer, you will receive the following. Our full-featured remote patient monitoring platform, including a custom-branded mobile app, provider dashboard, and connected devices. Our automated alerting, escalation, telehealth, time tracking, and super bill tools, and on-demand expert support. Now, given our commitment to each of our clients and the time we invest to maximize reimbursements, we only work on 5 implementations per month. And of course, if you don't receive any RPM reimbursement, our RPM fees are credited back to you. So we only get paid if you get paid. So to get started, all you need to do is take our short quiz to see if your organization is a fit for RPM. Based on the quiz results, we may schedule a Q&A and tour of our technology. There is a link to the quiz alongside this video. Thank you. Now, I will answer some commonly asked questions about our offer. And if you feel like you have enough information, please go ahead and take the quiz. But if you aren't convinced yet, or you still have questions, please stick around. First off, why is RPM reimbursed across all specialties? Well, RPM is useful to monitor any condition outside the office, which ultimately prevents adverse outcomes. So it can be used to support both acute and chronic conditions across specialties, but it is important to use connected devices that provide data relevant to those conditions. So, for example, a blood pressure cuff for hypertension. Why do nearly all payers cover RPM? Well, CMS is highly supportive of RPM as it is proven to reduce overall healthcare costs, and most commercial payers have taken CMS's lead by instituting RPM as well, and more of them add it each year. So reimbursement rates have actually stayed very strong, and eligibility has actually expanded, so a broader range of providers are now able to deliver these services. Why are reimbursement rates so high? Well, payers want providers to deliver these services because they are less costly than hospital admissions or other complications that can occur otherwise. I don't need it. You don't need more revenue. Then you are a lucky person. I don't think I can afford it. Well, as we went over, the upfront costs are minimal, and all the RPM fees are contingent on your success, meaning you have to generate revenue in order to pay any of those fees. We would be happy to provide a profitability calculator to whomever has budget authority, or schedule a brief call to discuss the benefits with that person. New services are hard to implement. How is this different? Well, RPM is not an entirely novel medical procedure or a new drug, and it does not require any new medical equipment or space within your facilities. In fact, you and your staff are likely providing some of these services already, just without getting paid. So monitoring a patient while they follow your treatment plan to ensure they're improving, it's common sense, both for patients and providers, and so RPM, it's really easy to explain. And in addition, much of the effort is handled automatically by our software. So implementation just requires training your billing and clinical staff for about 2 to 4 hours of total time. What if I don't have time? Well, it takes very little time. The training only takes a few hours, and the entire program can be run by your office manager or another staff lead. All you need to do as a physician or other senior clinician is to sign off on the services before they're billed. Can I trust you? Well, you've seen some of our testimonials and case studies so far, but I would be happy to provide a direct reference to prove our value and credibility to you. Are there any long-term contracts? So we have an annual agreement for our base license, but for many clients, this is actually covered by one of our partner companies. So you should look into that and we can help you with that. Also, we believe it is important to have some small upfront investment to ensure you and your organization are serious about successfully implementing our solution. A competitor has a lower price. Why should I work with you? Well, the most expensive vendor is the one that doesn't get you paid. And we talked about the importance of claim success rate and our success with that. So I think another vendor that doesn't have that level of success, they're going to be far more costly in the long term. Why shouldn't I overwhelm my organization with every patient I can find? Well, doing so just impairs the quality of care because you are forced to spend less time with each patient to move on to the next. And in addition, this leads to long, stressful days and overworked, dissatisfied staff. Can I take advantage of these services with my current staff? Yes, absolutely. Your current staff can use underutilized time to deliver these services. In addition, Since you are not overwhelming your organization, your existing staff will have the capacity to focus on patient care, including RPM. And an example of underutilized time would be a missed appointment. So if someone misses an appointment, your staff can go and monitor patients on our platform and still get paid for that time. Can I take advantage of RPM even if I don't want my own staff to deliver it? Yes, we have a staffing partner who can deliver RPM based on your referrals. Will this work outside the US? So RPM is specific to US insurers and will not work outside the US. But we do offer a virtual health product that enables you to utilize our solution for other purposes. And you can find more information about that on our website. What if some of my payers do not cover RPM? Well, Medicare covers these services nationally, and we've actually directly pre-verified coverage by over 100 commercial payers in over 30 states. So it's unlikely that your payers do not cover RPM at all. However, if we find that they do not cover, in fact, then we will actually advocate directly with the medical director at that payer to implement an RPM policy. And we've had success with this approach before. Does this work in my state? Yes. Medicare covers these services nationally. And again, we've directly pre-verified coverage by over 100 commercial payers in over 30 states. Are reimbursement rates good in my state? Well, Medicare reimbursement rates are set by region, and so they're adjusted for cost of living. Commercial payers, they typically follow those Medicare adjustments, but you can look up your actual RPM reimbursement rates by contacting your payers. What if a patient doesn't have a smartphone or tablet to connect to the RPM device? Well, first of all, 85% of American adults have a smartphone, including the vast majority of elderly people. However, if a patient doesn't have a smartphone or tablet, they can also use the device of a caregiver or family member for RPM. And we find this works in many cases. What about the bureaucracy at my health system or physician group? They take a long time to approve services like this. Well, we have all of the necessary security and other information to fulfill the vendor vetting for your health system or physician group, as we have completed these processes many times in the past. So we can work directly with your IT or other teams to complete this process so it doesn't take up your time. However, we do recommend having a senior champion who can help push this process through if there are ever bureaucratic delays. Are the RPM rules very clear? I have heard different interpretations and opinions. Yes, they are clear if you know what you are doing and have the right sources of knowledge. See, that is the benefit of our RPM billing experts. We also have direct insight and clarity from our contacts at CMS and commercial payers. You have a monthly fee and a competitor does not. Why should I work with you? So some RPM vendors have no upfront costs, but we believe it is important to have some small upfront investment to ensure you and your organization are serious about successfully implementing our solution. And if you look at the numbers, in the long term, we're usually more profitable for you, and usually within just the next month or two. Does this work if we use outsourced billers? Yes, it works with both outsourced and in-house billers. And as I mentioned, we can also do the billing for you. But if you're doing the billing or your outsourced billers are doing it, then our billing experts will still guide them indirectly there. Can I ramp up quickly if I have a big team? Yes, as long as multiple staff members can train at once. So we've trained upwards of 30 plus staff members at a time before. Now is not a good time. Well, I get where you're coming from. Everyone's busy. But before you make that decision, remember how much revenue you can gain over that period of time by starting now. So just ask yourself, what else are you doing now that will add over $1 million of revenue per month? I currently work with another company to deliver RPM. Okay, I understand. So just ask yourself, what has worked well and what has not worked well with that company? So in the case study section I went through before, you can find testimonials showing how much more revenue you can generate working with us, our success rates, our execution experience. So use that and you can come to your own decision. Do you do EHR integrations? Yes, as long as the opportunity is large enough to justify the additional technology development work. So typically this is reserved for clients like you, our health system and physician group customers. But just keep in mind, there are also other ways we can share data with the EHR even without an integration. So there's that option as well. So that concludes our Q&A. Thank you for your time. And again, please fill out the quiz and we'll follow up with you if it makes sense to have a Q&A. And thank you again.